Hi everyone, I'm Jodie Ann Senior. I'm a cardiologist and a heart failure specialist. Today I would like to talk to you about what I find is probably one of the biggest mistakes that patients make who have heart failure and require fluid restriction. So if that's you, then please do me a favour and don't do this. So I think what happens generally is patients have an event, they get admitted for heart failure. That might mean that they've developed breathlessness, can't lie down flat, cough at night, develop wheeze that they didn't used to have, get swelling in their feet, ankles, thighs even, or maybe it comes more in the middle and they notice expanded middle even though they haven't been eating as much because they haven't actually had the energy or haven't felt like it. They feel fuller, those types of things. And so they get admitted to hospital, they get treatment for that. They might even be put on intravenous diuretics like furosemide or Lasix. And as a result of that, they'll lose that fluid, feel better, watch the leg swelling disappear, or see that the breathing is better, they're more comfortable lying flat, that kind of thing. And what they might notice also is that the nurses are getting them up early in the morning to weigh them each day and record the weight. And when the doctor comes in, the doctor's asking, like, what's your weight today? And they're looking for that trend down. And then everything improves. The patient then goes home and then maybe is asked to come back for follow-up in some weeks after that visit. They're probably told at the time to stay on the fluid restriction and keep weighing themselves every morning, but sometimes that doesn't sink in, or it has sunk in, but things are going so well over the following weeks that either it's forgotten or it's felt that it's not necessary anymore because everything's pretty stable and going well. Something like this happens, and then for whatever reason, the weighing stops, and then the creep comes back in, and by the time you see a specialist, or maybe it's even months later when things have been very stable for some time, the weight gets dropped off. As in the weighing yourself every morning gets dropped off. And here's where the problem is. The weight is done so that we can track your fluid state. If your weight goes up or down fairly quickly, so within a period of 24 hours or 48 hours or even 72 hours, then the most likely reason for that is going to be fluid gain or fluid loss. Once we've reached your target weight, we want to see that it's stable. And the main reason for this is we don't want you getting sick again and bouncing back into hospital. We would prefer if we could catch this at an early stage where perhaps you've only put on a kilo or two, and that kilo or two is equivalent to 1 or 2 litres of water in your body. It's not that you gained fat or muscle. Most likely thing is that you gained water. And if we catch it at that point, then if we have an action plan to reduce that weight again by more diuretic or less fluid in, then you're going to avoid hospitalization. But more importantly, you're going to avoid being sick, and you want to stay out of hospital, which is better for you and everyone really. So that's why we're asking you to track this. And if you don't track it or monitor it and you don't measure it, then you can't intervene. And we need to intervene in a timely fashion so that we can prevent you from getting very, very sick. So it's really important, if you've been asked to fluid restrict and weigh yourself every day, that you actually do that. Now, of course, there'll be people who'll say to you, oh, why do you need to weigh yourself every day? Surely once a week is good enough. Surely you could just weigh yourself every couple of weeks, maybe once a month. Isn't that what you do when you're trying to lose weight? Yes, when you're trying to lose weight and the weight loss is fat loss, this happens very slowly. So this makes no sense at all to weigh yourself every day and obsess and worry about what the little fluctuations are. Because guess what? The little fluctuations are water changes in your body. Those little rapid fluctuations, that's what that is. It's not fat loss, it's not muscle loss, it's water loss. So this is where it's really important for you to weigh yourself every day if you're monitoring heart failure. Monitoring fat loss is a completely different story, and yes, you don't have to weigh yourself every day, and probably you shouldn't weigh yourself every day, but this is very different. We're not tracking your fat, we are tracking your fluid, and that's why it's important. Now, weighing yourself every day should look like this. You get up. What's the first thing you do after you get up? Do you go to the bathroom? You probably do. You probably need to go to the toilet. So here's what I'd suggest. Say you're in your PJs and you get out of bed. The first thing that you do is you go to the bathroom, you go to the toilet. You might empty your bladder and maybe your bowels. And when you've done that, pull out your bathroom scales, stand on your bathroom scales in your light pajamas, and do that every morning. Record it, record the date, record the weight. And then that's what you should take to your doctors, whether it's your general practitioner, whether it's a general physician or a cardiologist or a heart failure specialist. That's what you want to take them. Even if it's 3 months worth or 6 months worth, it doesn't matter. Just take it along because they'll appreciate that data, just like they like to see your blood pressure or your heart rate monitoring or whatever it is that you do for them. So same scales every day because we're looking for the trend on your scales, and that might be slightly different to the weight that you left at hospital with, but that's okay. And preferably the same level of clothing, whether that's pajamas or nothing at all, but don't get on scales with a heavy dressing gown because that is going to alter your weight. And don't do it late in the day when you've already had breakfast or 3 gallons of water. No, you're not having 3 gallons of water. I joke. I jest. Sorry. Your water intake, whatever it is, and whenever it is going to affect your weight. So preferably you would do this after going to the toilet and before you've had breakfast or before you've had water and your pills and that kind of thing. Hopefully this is clear. Daily practice. Make it like getting up and brushing your teeth or whatever it is you do, but make it the first thing you do, perhaps after going to the toilet. This will make life so much easier for those of us tracking you. Again, we want to pick up early changes and shifts, have an action plan in place so that we can then get an alert or you know what to do when your weight shifts and prevent you from coming back into hospital, but more importantly, prevent you from being sick. And also once you've got that fluid overloading your lungs and body and bowels and whatever, then your medication's going to be absorbed in a less efficient and effective way. They're not going to be as good. So this part of your management is truly critical. If this has been helpful to you, please like the video. This helps push it out to more people like you who need this information. I do these videos free, and I do them because I really want patients with heart failure to be very well educated and informed about how they can help manage their own conditions with their medical specialists or carers, whomever they are in your world. This is to help you help them manage your conditioning and get the very best care that you can possibly get with the very best outcomes. Because truly these sorts of things that you can do will make a huge difference. So please subscribe so you don't miss any of the videos that come out about every week. And I look forward to seeing you next time. Also, if you have any suggestions for me, either topics or things that you'd like explained, then please feel free to leave them in the comments and I'll do my best to cover it as well. Okay, thank you very much.